Hello and welcome everyone. So there are many dental terminologies used during dental school as well as in dental clinics, and for someone just starting out with dentistry, these terminologies may seem difficult to understand. So today in this video I will be discussing the most basic dental terminologies commonly used in dentistry and that could be necessary for a dental student to understand. Of course, I cannot cover all of the terminologies, but I have included the very basics of dentistry to help you get started. So let's start first with the basic aspects of the oral cavity. For those of you who don't know, the mouth is usually referred to as the oral cavity. In our oral cavity, we have two sets of teeth. The upper teeth, known as the maxillary teeth, and the lower teeth, known as the mandibular teeth. Both representing the maxilla, the upper sets of bones, and the mandible representing the lower jaw respectively. So humans have four types of teeth. These include incisors, canines, premolars, and the molars. The incisors are the frontmost and hence the most visible teeth during smiling or eating. They are further divided into central and lateral incisors. The canines are the longest teeth in the mouth, basically used for tearing of meat and other hard chewy stuff. These are basically developed in carnivores. Then we have the premolars and the molars, which are the posterior teeth used mainly for cutting and grinding of food. The entire set of teeth, including the upper and the lower teeth, is known as a dentition. The period occupied by these teeth are referred to as dentition periods, and there are three dentition periods in human beings. Let me explain this concept about various dentition periods even further. So the first tooth that emerges into the oral cavity in a toddler is the primary lower central incisor at the age of around 8 to 9 months. This marks the beginning of the primary dentition or the primary dentition period, which continues until the child is 6 years old. During this period, new teeth are continuously being erupted into the oral cavity. The teeth that erupt during this period are called primary teeth or deciduous teeth. Humans have in total of 20 deciduous teeth, including 8 incisors, 4 canines, and 8 molars, but no premolars. There are no deciduous premolars and hence premolars are absent during deciduous dentition period. By the age of 6 years, the primary teeth now begin to shed off and the permanent teeth now begin to replace them. This marks the start of the so-called mixed dentition period, which continues until the permanent second molar has erupted, usually around the age of 12 years. Now these eruption sequences of various teeth may sound confusing, but don't worry, I will explain all of them in my next video, just trying to understand the basic concept about dentition period. So by the age of 12 years, almost all permanent teeth have emerged into the oral cavity and all the deciduous teeth have been shed off. For some, it can take 6 to 8 months more or less. Within this range, it is considered normal, but anywhere above or below this range, that means if a tooth sheds 1 year earlier or 1 year later, then this may refer to an underlying problem and it is best to get it checked. Now at this stage, the child finally enters the final phase, that is the permanent dentition period. Since now all of the permanent teeth are present, except for the third molars, which have the most anatomic and eruption time variation among all the teeth. So to conclude this short story on dentition period, the primary dentition period starts when the first milk tooth erupts into the oral cavity. Then by the age of 6 years, shedding of the first primary tooth and simultaneous eruption of the permanent tooth starts the mixed dentition period. And in the end, the final eruption of the second molar in the oral cavity marks the end of this mixed dentition period, and now the young adult enters into the permanent dentition period. Remember, at this stage, under normal circumstances, all the primary teeth have been shed off and the permanent third molar has not yet erupted. So moving on, including the third molars, humans have in total of 32 permanent teeth. These include 8 incisors, 4 canines, 8 premolars and 12 molars in total. So now let's discuss the parts of an individual teeth. So a tooth consists of two parts, that is the crown and the root. The crown is the upper part usually visible in the oral cavity when a person talks or smiles. The outermost layer that covers this crown is known as the enamel. Enamel is a thin, translucent layer that is also the most hardest tissue in our body, even surpassing bone in its strength. The crown can be further divided into the anatomical crown and a clinical crown. The clinical crown is a portion that is visible in the oral cavity and can be seen. It is a portion of the crown that is above the gums. However, there is also some portion of the crown embedded inside the gums, which is usually not visible but is also covered by the enamel. And this entire crown, that is the part of the tooth covered by enamel, is known as the anatomical crown. However, the root of the tooth is almost always embedded in the gums and is only revealed under special dental problems. The root begins where the enamel terminates and hence is not covered by the enamel. Rather, the outer portion of the root is covered by a hard tissue known as the cementum. Cementum is not as hard as the enamel, but it is quite strong and its strength is comparable to that of the bone. The junction where the crown of the tooth and the root meet with one another is known as the cemento-enamel junction, since the enamel of the crown meets with the cementum of the root. This junction is demarcated by a visible line named as the cervical line. So in short, the crown is the portion of the tooth covered by the enamel and a huge chunk of which is visible in the oral cavity, while the root is the portion of the tooth covered by the cementum and is usually embedded in the gums. Now let's talk more about the hard and the soft tissues that are normally present in a single tooth. So there are 4 tissues that collectively make up the structure of a tooth. 3 of them are hard tissues, which include enamel, dentin, and cementum, while 1 is a soft tissue, the dental pulp. Enamel, as discussed, is present only on the crown and is the hardest tissue in our body. Perhaps the reason why it is so strong is its composition. It consists of about 96% inorganic material, while the rest is approximately 3% water and 1% organic material. The next layer is the dentin, which forms the bulk of the tooth and is present in the crown as well as in the root. It functions to provide support to the enamel. The third hard tissue present in our tooth is the cementum, which, as discussed, covers the outer portion of the root. It consists of about 45 to 50% inorganic material and 50 to 55% of organic component. Dental pulp is the only dental soft tissue and is found in the core of the tooth beneath the dentin. The pulp is rich in blood vessels, nerves, and other tissues and is responsible for the health of the tooth, providing vital sensation. The pulp is essentially what makes the tooth alive. So moving on outside, the tooth is placed in a pocket of bone that is like a socket, hence named the dental socket, or more correctly, the alveolar socket, since the bone that surrounds the tooth is known as the alveolar bone, and hence the socket in which the tooth is placed is known as the alveolar socket. But the tooth is not directly in contact with the bone. There is a space or a medium in between. This medium is filled with many fibers. These fibers function to hold the tooth against the bone and provide a kind of shock absorbing ability to the tooth. Along with these fibers, blood vessels and various cells are also present here. So in the end, let's move on to some other terminologies commonly used in describing a tooth. So every tooth has 4 sides: the proximal side, the labial or the buccal side, the lingual or the palatal side, and the occlusal or the incisal side. The term proximal implies to those surfaces of the tooth which are usually in contact with the adjacent teeth. Hence, this includes 2 sides, the mesial and the distal side. The term mesial is used for those surfaces of the tooth which are towards the midline, whereas the term distal is used for those surfaces which are away from the midline. Let's take an example to understand it much better. Consider 3 teeth: the right central incisor, the left central incisor, and the right lateral incisor. Now the surface of the right central incisor that is in contact with the left central incisor is its mesial surface because it is nearer to the midline, whereas the surface that is in contact with the right lateral incisor is its distal surface. The same can be said for the right lateral incisor as well. The mesial surface of this tooth is in contact with the central incisor, while the distal surface is in contact with the canine, and so on and so forth. So the next surface we have is the buccal or the lingual surface. So the surfaces of the teeth which are facing the lips in the case of incisors and canines and facing the cheek in the case of premolars and molars are known as the labial and the buccal surfaces respectively. These are the surfaces, particularly the labial surfaces of the incisors and canines, are usually visible when a person smiles and therefore are aesthetically very important. Next, we have the surfaces of the teeth facing the tongue, named as the lingual surface in the case of lower teeth, and those surfaces which are facing the palate, named as the palatal surface in the case of upper teeth. Just so that you know, the roof of the mouth is known as the palate, and the surfaces of the maxillary teeth facing the palate are referred to as palatal surfaces. These surfaces, the palatal and the lingual surfaces, are usually not visible when a person talks or smiles and hence are hidden from the normal eyes. And lastly, we have the occlusal or the incisal surfaces. These are the tooth surfaces which are used for chewing or biting down food. We use the term occlusal for premolars and molars and the term incisal for incisors and canines. The knowledge about these various surfaces is extremely important in order to not only identify, understand, and reproduce the anatomy of a tooth, but also to be able to understand the more depth knowledge about dentistry itself. So this was a very basic outline of the most basic terms used in dentistry. I will be discussing more of such terminologies in my future videos, so make sure to check them out. If you want more study notes, practice questions or quizzes, make sure to check out our Patreon page at patreon.com/studywithadentist and consider supporting us there. So that's all for today. Thank you for watching till the end. I will be meeting you guys next time. Till then, take care of yourselves and your loved ones. Stay safe and goodbye.